All right, good afternoon, everyone. This is the House Appropriation Committee, Public Safety and Administration Subcommittee. For the record, Delegate Tony Bridges, Chair of the Public Safety and Administration Committee, along with Vice Chair Julian Ivey, Delegate Sasavaro, McComas, and Stonko. We have 4 agencies that we're going to hear from today, and we are going to go in order, beginning with the Department of Juvenile Services. But first, we will have the analysis by our analyst, Madeline Miller.
Thank you. My name is Madeline. Today I'm presenting the DLS analysis for the Department of Juvenile Services. The fiscal 24 budget increases $13.8 million to $322.4 million. Most of the growth is attributable to salary enhancements. DJS is tasked with supervising and treating youth involved in Maryland's juvenile justice system. The department oversees youth from the point of referral through the adjudication process to re-entry into society. The first portion of my analysis will describe the population served. Typically, that would include juvenile arrest data. However, the Department of State Police has yet to publish the 2021 Uniform Crime Report data. Arrests are one way that youth become involved with DJS. Exhibit 1, on page 5, shows complaints received by DJS and their dispositions, which include formal cases which require court intervention, those cases which are closed at intake, and cases that are handled informally. So DJS received nearly 52% more complaints in fiscal 22 compared with fiscal 21. The number of complaints was still almost 28% lower than in fiscal 2020. Cases that are handled informally are monitored as part of the non-residential caseload, along with youth on probation or youth receiving aftercare programming. On page 6, Exhibit 2 shows the non-residential caseload trends. Consistent with the overall decline in complaints, the department's non-residential caseload trends have similarly declined over the past decade. Probation and aftercare cases are projected to be historically low in fiscal 2023, consistent with efforts to keep youth from becoming court involved. Then moving on to page 10, Exhibit 4 shows population trends for the department's detained population, those children who are waiting for their court date, waiting to be placed in a community facility, and those youth who are adult court authorized. Due to complaints rising in fiscal 2022, complaints projected to increase in fiscal 23, and the courts having been fully operational during fiscal 23 for the first time in a few fiscal years, the ADP, or average daily population, has risen to 205 youth in fiscal 23 year-to-date data. I'll also note that the adult court authorized population now accounts for over 61% of the population. It's the 3rd year in a row that it has made up over half of the detained population for the department. Exhibit 6 on page 12 shows committed youth data. State-run committed residential facilities do not provide adequate capacity to accommodate the number of youths requiring out-of-home placements, nor do they provide the full complement of programming required to address the variety of treatment needs for the committed population. To that end, DJS contracts with private in-state and out-of-state vendors to provide services to committed youth. Consistent with the overall DJS population trends, the committed residential ADP continued to decline in fiscal 20 and 21. The committed average daily population declined further by about 13.6 youth, or 9.3%, between fiscal 21 and 22. Fiscal 23 year-to-date data suggests that the average daily population will continue to drop another 2% to 130 youth. Following committed placement, DJS continues to interact with youth. After the youth have been in the community for 30 days, a DJS reentry specialist follows up with the youth and family to ensure that the youth has accessed all needed services. The outcomes of follow-up visits are documented and reported to the department as shown in Exhibit 7. Compared with fiscal 2017, the first year of available data, only 2 measures were improved in fiscal 2022. While these measures detail efforts to better ease the youth's transition back into their community, DJS's recidivism measures provide a greater understanding of how many youths return to the juvenile justice system, shown in Exhibit 8 on page 15. The decline of the rearrest rate suggests that policing practices are beginning to rearrest youth at a slower rate, while the decline in the readjudication and recommitment rates suggests that juvenile justice system has been effective in reducing youth involvement in the judicial system. Though the rearrest rate for the 2019 cohort rose compared with the 2018 cohort, the declines in the 2-year recidivism metrics extending to the 3-year recidivism measures is a positive indicator that fewer youth are returning to the juvenile justice system. And I'll turn to the budget discussion, which is shown in on page 17 in Exhibit 9. DJS receives $322.4 million in the governor's fiscal 24 allowance, about 73% of which supports DJS's personnel expenses. With about 2,200 positions, DJS is one of the largest agencies in the executive branch. Youth programming accounts for approximately 10% of the fiscal 24 allowance, and then as discussed later in this analysis, these costs fluctuate based on the department's population trends for youth, and changes to the department's budget are primarily driven by changes in youth programming expenditures each year. The remaining funds are allocated toward operating expenses, miscellaneous contractual services, and supplies and equipment related expenses. Exhibit 10, which begins on page 18 and continues on to page 19, shows the change of about $13.8 million. Personnel expenses increased the budget by $8.4 million, and that includes reclassification of 631 resident advisor positions and a bonus for all resident advisor positions hired after November 15th, 2022. That also includes annualization of the November 2022 4.5% COLA. Various IT projects add $4.6 million and utilities add another $1.3 million. Growth in the department's budget is offset by a reduction in per diem costs and for the removal of grant funds. Funding for ROCA Baltimore is currently mandated at $2 million per year. However, an additional $1 million was provided in fiscal 23 only via supplemental budget number 5 of 2022. For more information, please see the update section of the analysis for how DJS and ROCA have been working together over the interim. I'll now discuss some of the changes to the budget a little bit further. The department's case management system, known as ASSIST, is being replaced in fiscal 23 by the Child, Juvenile, and Adult Management System, or CJAMS. Implementation of CJAMS will allow DJS to participate in the Maryland Total Human Services Integrated Network, abbreviated MD-THINK, along with other state agencies. DLS asks that DJS comment on the startup and ongoing costs associated with CJAMS and joining MD-THINK. DJS should also comment on how these projects will allow the department to better manage its population and how joining MD-THINK will improve interactions with health and human service providers in the state. Exhibit 11 on page 20 compares the committed residential average daily population with per diem funding in recent fiscal years. As the per diem population has continued to drop, the department's funding for per diem programming accordingly declined through fiscal 2022. Per diem funding decreases by 16.4% in fiscal 24 allowance to $17.1 million, bringing it closer in line with fiscal 2022 expenditures. But you'll notice that there's a rise in between fiscal 22 and 23. Given the continued decline in population and lower funding level in the allowance, it's possible that the working appropriation provides approximately $2 million in excess residential per diem funding, and that would have been based on population estimates from last year. I'll now discuss some changes to the departmental's personnel. Though there's no change in the number of regular positions between fiscal 23 and 24, DJS removes a net 20.5 contractual positions, including 22.5 resident advisor trainees from the Facility Operations Administration and Support Program. Personnel expenses, like I mentioned previously, increased by approximately $8.4 million after accounting for the annualization of the November COLA, position reclassifications, which are the result of an agreement between the state and the American Federation of State, County, and Municipal Employees, as well as changes to the department's overtime allowance. This allowance increases $1.3 million, which brings funding approximately in line with fiscal 2022 level of spending. Additionally, the allowance assumes a turnover rate of about 6%, despite much higher vacancies, in order to give the department flexibility in hiring. The document says 5, but that's a typo, and it will be fixed in the final version of the document published later this year. At the close of calendar 2022, 16.3% of the department's total positions were vacant, and high vacancy rates, particularly among facility direct care employees, result in increased overtime expenses and can cause further issues for the department, including issues with morale. Exhibit 12 shows the vacancy rates for community and direct care staff since June 2018. And for community is shown at the bottom of page 22, and those for the resident direct care staff is shown at the top of page 23. I'm going to kind of skip the remaining portion of that personnel and go to the issues section because the two are closely related. The first issue for the department is that DLS estimates staff vacancies within DJS may result in a fiscal 23 surplus like there was in fiscal 22. The fiscal 22 closeout analysis is provided in Appendix 2 of this document. So in that year, DJS reverted approximately $15.6 million to the general fund, $12.6 million of which were from unused funding that would have supported regular and contractual personnel costs. Having some excess general funds allows DJS to properly fund an item at the end of the fiscal year, but the discrepancy can also present an unrealistic working appropriation number for the Budget Committee to consider. At the start of fiscal 23, 173 positions were also added in association with the assumption of the Juvenile Services Education Program, and those can be seen in the increased vacancy rate between fiscal 22 and 23, shown in Exhibit 13. Since the start of fiscal 2021, the vacancy rate has grown 9.3 percentage points, with an average vacancy rate of 7.3, 12.2, and 15.7% in fiscal 21, 22, and 23 year-to-date, respectively. The department's turnover rate is currently budgeted at about 6% in order to encourage hiring. However, assuming that DJS can hire enough positions by the end of the fiscal year to bring fiscal 23 vacancies down to their average fiscal 22 level of 12.2%, there will still be excess funds the department has for personnel. DLS estimates that DJS would need approximately $205.4 million for its regular positions in that scenario, and the working appropriation currently contains $219 million, suggesting an over budgeting of at least $13.6 million. And a lot of that vacancy, again, is concentrated in the community and direct care staff. That's certainly not where it's limited to. The second issue for the analysis is that DJS receives no capital funding in the fiscal 2024 budget. Exhibit 14 on page 26 shows the planned funding for 3 buildings: the Charles H. Hickey Jr. School Combined Services Building, the Cheltenham Youth Detention Center addition for female youth, and the Cheltenham Youth Treatment Center. The fiscal 23 CIP had planned to fund 2 projects in fiscal 23, the Cheltenham Youth Treatment Center, CYTC, and the addition for female youth at the CYDC. The CYDC's total capacity is currently, would become 96, which would help to consolidate the female youth detention services provided in the state. Both the CYTC and the CYDC, however, remain in the design phase, resulting in delays in the need for construction funds. The department's plan for housing female youth has evolved over time. The CYTC project was previously going to be a detention center for female youth and is now, where the function of it's replaced by the addition. And it was also previously going to be on a different campus before the funding had been set for the Cheltenham campus. In November 2021, DJS announced a major facility realignment plan, part of which involved adding that detention wing for female youth and the closing of Noyes in fiscal 2025. The plan also included the closure of Waxter in January 2022, although that was ultimately pushed back to March of 2022. One of the ways that the department addressed its vacancy issues during the fall of 2022, so during the working appropriation, was by temporarily closing Noyes. The female youth there were relocated to the CYDC and the Victor Collins Center, while staff were relocated mostly to the Cheltenham campus. DJS is only able to do this, or is only able to adequately house the female detention population this way due to its such limited size at the moment. When the temporary facility closure began, it was the department's intention to reopen Noyes sometime in January 2023. However, the department has not yet done so. DLS asked that DJS comment on its plans to reopen the Noyes facility for female youth and whether any other temporary facility closures are planned to accommodate the department's staffing needs or for any other reason. DJS should also comment on if there have been any modifications to the facility realignment plan or to the scope of its projects, particularly those relevant to its female youth. The final issue, or the third issue, relates to the Baltimore City Strategic Partnership. Together with the Baltimore City Mayor's Office, the Baltimore City State's Attorney's Office, and the Baltimore City Police Department, the partnership was meant to align and coordinate case management resources to more effectively and appropriately intervene in youth juvenile cases within the city. The fiscal 23 budget withheld $500,000 for a report to be submitted by the end of calendar 22. DJS reports that collaborative efforts continue, but they are not done through a formal partnership. The stakeholders have several strategic actions to reduce youth violence, which are aligned, however. These actions include expanding the DJS Police Liaison Unit, use of the Sidestep pre-arrest diversion program, establishing an emerging adult unit in Baltimore City, group violence reduction strategy in Baltimore, curfew visits with DJS and the Baltimore Police Department, and in addition to a few others. The report also included data from fiscal 2015 through 2022 to demonstrate how measures typically reported by DJS have changed for youth in Baltimore City. Performance measures specific to the strategic actions are not provided, and the report does not attempt to distinguish between the effects of the partnership and the impacts of the pandemic. However, complaints for Baltimore City youth fell by 77.9% within that time frame, and a higher proportion of complaints come from adult court transfers than any other prior year. DLS recommends that the funds for the report be released to the department as the information has been requested. The information requested has been successfully submitted. With that, the DLS concurs with the governor's allowance, and I'd be happy to take any questions.
Thank you, Madeline. Are there any questions for the analyst? Let me just note that we're also joined by the Vice Chair of Appropriations, Delegate Chang. Any questions for the analyst? All right. If not, thank you very much. Definitely appreciate your thorough analysis. And with that, we will now bring up Acting Secretary Vincent Girardi. I guess we won't have to say acting in a few more hours, maybe?
That's the hope, sir.
Thanks for joining us today. Congratulations in advance.
Thank you for having me. I appreciate it.
And please, if you have any others that you wanted to bring up and introduce as well, please bring them up. The floor is yours.
Good afternoon, Chair Bridges and members of the committee. I'm Vinny Giraldi, Acting Secretary for the Department of Juvenile Services. To my right is Michael Batista. He's our Chief Financial Officer. And to my left is Kara Annison, the Director of Legislative Policy and Reform. Thank you for the opportunity to respond to the Department of Legislative Services fiscal year budget analysis. I'd like to thank Ms. Miller for her thorough analysis. I'm proud to join the Maryland Department of Juvenile Services as Acting Secretary, and I'm particularly proud to further Governor Moore's goal of leaving no one behind, which I think is particularly relevant to juvenile services. Over the past decade, DJS has experienced significant declines in the number of young people referred to the juvenile justice system, as well as reductions in the utilization of incarceration, out-of-home placements, and community supervision. As these populations have declined, recidivism rates have also consistently dropped each year, indicating that the state can have positive public safety outcomes for our young people and communities, less youth incarceration, and greater equity. DJS is in the beginning stages of implementing two major reform efforts aimed at improving how young people experience our juvenile justice system. One is the juvenile justice reform legislation, and the other is creating a new juvenile services education program. First, the Maryland General Assembly passed the Juvenile Justice Reform Bill during the 2022 legislative session, which took effect on June 1st, 2022. DJS is committed to working with juvenile justice stakeholders, the courts, prosecutors, defense attorneys, law enforcement, educators, social service and mental health agencies and personnel, families, young people, and community leaders to ensure that the implementation of the new law is successful. So far, data from the first 6 months of implementation already indicate a positive impact on system operations and outcomes. Specifically, as required by the new legislation, DJS has increased the utilization of successful diversion strategies and decreased the utilization of incarceration for low-risk young people. This comports with research and experience that shows that incarcerating low-risk youth increases their risk of reoffending, and conversely, the diversion of low-risk youth can improve recidivism outcomes. On July 1st, 2022, the Juvenile Services Education Program transitioned from the Maryland Department of Education to the Department of Juvenile Services. DJS and JSEP leadership collaborated with the Department of Budget and Management to support the education staff during the operational changes, and were even able to provide an increase in teacher salaries. As a member of the JSEP board, I'm excited to work along with the entire board and JSEP program staff to expand the available offerings and provide the best education services to the young people in our facilities. My vision for DJS is to continue to improve public safety through direct community engagement. Enlisting local communities in partnership with DJS will help change our young people's trajectory to one of hope and success. The majority of young people served by DJS return home, back to their home communities. So building strong connections with those communities will improve outcomes for young people, not just by reducing their recidivism rates, but also by improving positive outcomes like educational attainment, workforce development, civic engagement, access to arts and athletic programming, and other positive youth development opportunities. Just the kind of opportunities all of us want for our own kids. By partnering with communities that are the least resourced and most heavily impacted, DJS can promote a more fair, just, and equitable youth justice system while ensuring public safety. I'm also committed to finding solutions to address the needs of the young people who, despite being our smallest percentage of our population, gain the most community and media attention. And those are the youth sent to us for violent offenses on one end, as well as youth under age 13 who have been diverted via the recent law. I look forward to starting an inclusive agency strategic planning process to chart a course for DJS going forward. I've committed to visiting every local office, every detention, and every treatment program that we operate. These visits will ensure that the strategic planning process is inclusive of staff, youth, families, and communities that we serve. And staff, it's very important that we tap into the wisdom of our frontline staff who often get overlooked in moments like this. I'm also committed to ensuring the strategic planning process is transparent and that the public and system stakeholders have ample opportunity to inform how we best serve Maryland. With that, I could read these answers, or I don't know how you want me to. Okay.
Yeah, you don't have to read them. Some of the members may ask you to comment a little bit more on some of the responses, though. But you just mentioned strategic planning, so I'll go ahead and start at least. I know there will be some other questions, most likely. But the strategic planning, I'm glad that you're moving forward with doing some strategic planning. Is that going to be internal? Are you bringing on a consultant to do that? How do you move forward with that?
When I ran DC's Juvenile Justice Agency in 2005, the federal government had this program where they would loan various different staff to DC government agencies, and one of them was the strategic planner for the FAA, who also was on Vice President Gore's Reinventing Government team. So she and I have been friends since then. She just volunteered to come help us with that. And then when I went to probation in New York City, she helped me with my strategic plan there, and then in corrections as well. So I've already talked to her. I'm hoping the feds will pay for that again. If not, I think we're giving a lot of money back, so I might be able to figure out a way to bring her on. But I'll do that. But really, that's just a consultant. And then what we have to do is go on around the state to our staff, to communities, judges, prosecutors, and do a listening tour. And I'm going to personally do that.
Yep. You know, so this is all in the planning stage. You haven't gotten a timeline together for when you plan on doing that just
I'm
yet.
hoping that we have a draft by May.
Oh, good.
Yeah. I don't want to fool around. I don't like long strategic planning processes.
Yeah, they can be very long. I'm doing one myself. Can you just keep the committee up to date on the plans with the strategic planning efforts?
Absolutely.
Yep. Just another quick question in regards to the CJAMS program. I know that you are, coming over into the new phase of how we monitor and track individuals. Can you just talk a little bit more about what that means and what the new program is all about?
Yes. So our current assist tool began being designed in 1985 and was brought online in 1999. So it's either 30 or 40 years old, depending on how you look at it. And it's just kind of old and clunky. And so my hope is that we'll get three things out of CJAMS. One is that it'll just be more user-friendly for our case managers, who are the ones mostly using it, and institutional staff. The other is it'll give me data, at the tip of my fingertips, so I can stop calling my data guy 3 times a day, which I do now. And the last one is I think it'll help us draw down on federal reimbursements. I guess one more is we're doing it jointly with our sister agencies, and very often, it's a maze for families. There needs to be no wrong door, and this could help us with that as well.
So it's like the Department of Social Services and others all using the same system?
Health Department.
Health Department, gotcha. Yep. Thank you. I'll turn it over for other questions now. I'll start with Vice Chair Ivy.
Thank you, Mr. Chairman. I appreciate the indulgence. Acting Secretary, it's a pleasure to see you.
Thank
the
you.
rest of the panel as well. Hopefully the Senate can move a little more quickly there. I wanted to know, because I'm a new member of the committee and subcommittee, so I don't know if you're the right person to ask, but ROCA, I see it popping up in this document here. Can you walk me through what ROCA is, what they do?
What it is?
Mm-hmm.
Yeah, they're an evidence-based practice that works most intensely with very deep-end youth, ages 16 to 21, I believe, but maybe a little older. Is that right? Oh, 26. So actually more of them are in the adult system than the juvenile system, but some of them are our kids.
Sure.
And they're the kids that have shown the highest risk. It's a pretty intensive program and long term. They're with them for years. It's not just a quick 6-month thing.
Yeah.
And they see them every single day.
It's unfortunate we need organizations like this, but where in our state do they mainly operate?
Well, right now, it'll be Baltimore City they're already operating, and they're expanding beyond Baltimore City. I think their biggest footprint will next be in Baltimore County. I believe they're going to go further than that over time, but that's just the first 2 stops.
Wonderful, and it's a successful program. It's got good results.
Yeah, with the toughest kids.
Okay, wonderful to hear that. The reason why I asked specifically where they do their work, I see that Prince George's County has been left out of that.
Mm-hmm.
Okay, could you speak to if you have any plans to expanding into the Washington suburb region?
My understanding is that the current plan for ROCA is Baltimore City and then outside Baltimore City. So I think they just started in Baltimore County, but that, to my knowledge, is not the end. It's just the beginning. Right. For me, more importantly, I hope to be going around the state and beginning to find people in communities who are already doing work with these young people that I think the department needs to partner with better and resource. So I'm sure you know, and I know, people working out of their cars, out of their basements, churches that are already trying to help these young people. And I just don't think we've done a good enough job reaching out to them. And then when we reach out to them, helping them with actual resources. And I really want to do that before I start to expand centralized groups, because these kids are going to live in those neighborhoods for the rest of their lives, or many of them.
I saw there's $1 million reduction from Broca here in this briefing. But really, I don't want to belabor the point. Community Justice Action Fund, I hope that you do reach out to them and have a discussion with them about how we can expand the footprint into Prince George's County specifically. I think it's a wonderful program. They're doing a lot of great work. We don't want to be left out.
Yep.
Thank you.
Yes, sir.
Thank you, Delegate. I think the delegate just wants to make sure that the resources go where the resources are needed. And Broca is definitely a good resource, one that I'm really familiar with in Baltimore City. I believe it's a Boston-based program that was brought to the city, and the expansion, if it could be expanded, is what we're trying to find a little need. That's it. Yeah.
I agree.
Delegate Acevera.
Thank you. Thank you, Mr. Chair. Welcome, Mr. Secretary. Congratulations. Looking forward to working with you and your team. Just a couple of questions for you. I know you're a few weeks on the job, but would you agree with the ample data that exists out there that solitary confinement, or as we call it here in Maryland, restrictive housing, has long-term damaging effects both on youth as well as adults?
Yes.
Would you also agree that that is a practice that should be ended in all juvenile justice agencies, to include Maryland?
Yes.
Good. Do you also agree that LGBTQ youth that are in the juvenile justice, that spend time within the juvenile justice system, should be referred to as their preferred gender identification, but as a matter of safety, there should be designated areas to ensure that they are placed so that they are not in immediate danger?
I think we should house them. I think we should refer to them in the way they prefer. I think we also should give them choice on housing. Some youth that are LGBTQ and transgender want to be housed with other youth of their stated gender. Some don't, and I think it's a little more complicated than just putting them where their stated gender is. It's just, but I think we need to work with the young people and figure out where they're most comfortable in being. They tend to have good sense of that.
Great, because that's what I was getting at. And then also, you're coming in. We, the legislature, we passed a good bit of juvenile justice reform legislation. So I'm really excited to see you assuming your role and working with us as far as implementation to ensure that we're driving down the amount of youths that are come into contact with our juvenile justice system. Now, I know there's been some complaints from some folks that now police do not have the mechanisms to essentially charge youth because of laws that we've passed about charging kids, et cetera. But I know that there's some folks in certain quarters that have, shared some concerns about not being able to charge kids. But I believe there is also accountability or a process through which they can, go with DJS in order to hold juvenile offenders accountable. Is that correct?
That is correct.
Can you share with the committee what that process is of accountability that exists, please?
Yes, sir. And this, I think, is an area where we just need to do better in terms of communication with police, with families, and with schools primarily, because those are the primary potential referral sources for these young people under age 13. So there's really kind of two big buckets of responses that the community can get from us relative to those young people. One is informal help. We can just help them. We don't need to formalize their case to provide them with certain services. And I don't think people understand that as well as they should. The other is the formal children in need of supervision process, SINs. They can refer kids to us. We can then go to the courts and file a SINs petition. if the judge adjudicates the kid as a SINS young person, then we can do everything with them that we can do with other children other than put them in a locked facility. So we can put them in group homes, we can put them in foster care, we can put them in any of the programs that we operate, everything except locked facilities, either as a placement or as a detention option. So that's quite a bit of stuff that we can do. We have plans right now to create an understandable bench book so that like regular people can understand it, and also to do lunch and learns throughout the state with law enforcement, with social service, educators, parents, so that everybody understands that better. It's month 7 of that law, so we've done some lunch and learns, but we need to do more.
Right, and to be clear, so there is a process or a system of accountability for juvenile offenders, and that is determined after analysis from your agency.
Correct.
So there is. Thank you very much. Congratulations again, Mr. Secretary, and we're looking forward to working with you.
Thank you, Delegate.
Thank you, Delegate. Delegate Stonko.
Thank you, Mr. Chair. I wanted to, kind of following along Delegate Acevedo's questions, continue to learn a little bit more around your up-to-date views on some policy frameworks that I have concerns around DJS with regards to previous statements or opinions that you've given publicly. Mm-hmm. Do you, I'm going to say still, but please opine upon it, do you still believe that 21-year-olds shouldn't be, anyone under the age of 21 shouldn't be exposed to the adult family or adult court of justice or adult facilities? What are your views with regards to ages where individuals should time out of or time into and out of DJS?
Sure, that's gotten a lot of attention, and was based, first of all, my focus is going to be on the kids that are arrested for crimes that occur before they're 18, because that's what my department currently has as its charge. But I think it's, out there a lot about what I've done in the past on that and said and written in the past. So it's mostly based on a paper I co-authored when I was at Harvard, funded by the Justice Department, that was released at the Great Hall of Justice with the Attorney General and Education Secretary John King. And in that paper, we took a look at the neurobiological data, the developmental psychology and sociology around kids ages 18 to 21 and even above that, most of which showed that that age group is more similar to 16 and 17-year-olds than it is to 30 and 40-year-olds, which is kind of what this adult system is more designed for. And so in that, when we presented that, we made a bunch of recommendations about special caseloads, special courts, special facilities that for young people, and consideration of raising the age in which kids could be in the juvenile system to 21. And some states have done special courts, some states have done special caseloads, special housing units. I had a special housing unit at Rikers. I had a special caseload at probation. We learned about a special project in Baltimore for that emerging adult age group. 7 states have proposed raising the age beyond 18. Vermont is the only one to pass it. And right now, 18-year-olds are in Vermont's juvenile system, and they gradually phasing it in. 19-year-olds, I think, start in July. I think all that stuff should be on the table, and I think each and every state should take an individual look at what they think is best. Maryland's taken some steps in the direction of special caseloads. As I said, every state's going to be different.
Does that include violent criminal acts like homicide or serious violent acts?
So 2 states, when I did this, asked us to help design their plans, Vermont and Connecticut. In both of those states, the same kids could be tried as adults that were 18, 19, and 20 as could be tried as adults that were 16 and 17. So sure, some kids are going to be tried as adults for violent crimes, and that would include the 18, 19, and 20-year-olds, just like it includes kids under 18.
Okay, and you support that?
Absolutely.
Okay, thank you.
Thank you. Delegate McComas.
When they talked about Roca being in touch with the kids, I guess, that are in some kind of facility, what type of engagement is that occurs pretty much daily? Could you elaborate on that?
Yes. So it's it's a sort of whole network of things that they're trying to do with the young people, help them finish school, help them stay away from negative peers. It's a really big one for the young adults, help them enter the world of work. Many of them have no experience with that, don't have any connections. They're not really sure what they want to do, and so they kind of gravitate towards negative behaviors. And they help them with, cognitive behavioral therapy, thinking through their actions before they engage in, illegal or even violent behavior, stopping and thinking. And that's something you can actually train people to do. I've witnessed that. It's a pretty impressive process. Just get kids to stop and think before they throw a punch at somebody who's maybe accused them of something. So all of that over years and years. They also really establish a bond between their workers and the young person. So when the young person's in some sort of crisis, they have a place to go, which many kids don't.
So do they also, if the child has a history of substance abuse, whether alcohol or drugs, that they provide them with that type of support?
Absolutely.
Now, the other question I have is, I know we have, church and state division, but are the kids or the children, let's say, given an opportunity to follow some type of religious, whether it be, any of the major religions, is that encouraged at all as well?
Yes, the kids can follow whatever religion or no religion they believe in, and there's a lot of religious groups that come in the evenings and on the weekends, both to provide religious experiences, but also just to be their friends and to help them.
The other quick question I wanted to ask you is I remember being a kid and seeing the bad seed. It was some kids have personality disorders, and you don't grow out of that. You can't medicate it, and some of them are antisocial. How do you deal with those children that all of the effort and magic isn't necessarily going to do it, and they really foster better in a facility as opposed to out on the street? How do you deal with that?
The thing I like the most about the juvenile justice system is that it really is designed exactly for this group of young people to both hold them accountable, and sometimes that means holding them accountable in a locked facility, to watch them, right, with probation officers and other staff, electronic monitoring, all those kinds of things, but to make every effort we can to help turn their lives around. And so really, the kids that are the most risky, as I said, in my testimony, are ones we really have to pay the most attention to. We have to know where they are at all times. We have to know that they're getting good wraparound services programs. While I agree with what you said, that some kids we're not going to reach, we are particularly poor at figuring out which those are. People say, I could tell in the second grade this kid was going to be X, Y, or Z, but I don't think that as a society we've really gotten to that point. So in my view, we're going to just try with every single kid we get. I'm not going to give up on any of them. But that doesn't mean they're all going to be in the community. Some are going to be in locked custody until their terms end.
Thank you, sir.
Thank you.
All right. Thank you, Delegate. Are there any other questions? Seeing none, I want to thank you, Mr. I'm going to say Mr. Secretary,
Okay,
because
don't jinx me.
Confirmation will happen. You'll be there. Thank you for getting through your first budget hearing with us.
Thank you, sir.
We'll see you again.
Look forward to working with you all.
Definitely. We do, committee, have some public testimony as well, and we'll call those individuals up. We actually have Denise Gilmore from AFSCME, Maryland, and Tanika Hernandez from AFSCME, Maryland as well. Or is it just going to be you, Denise? We know you can represent well, so.
I'll do my best. Yes, unfortunately, Ms. Hernandez could not make it anymore, but good afternoon, Mr. Chair.
I'm sorry, I'm not going to start the timer yet, but I do want to let everybody know public testimony is 2 minutes.
I've been well trained, I promise. Thank you, Mr. Chair, members of the subcommittee. Denise Gilmore here. I am the legislative director with AFSCME Council 3. We represent the state employees who work at the Department of Juvenile Services. Just wanted to make a few points, particularly around staffing. We want to lift a few areas up from the analysis, and also thank you for the great analysis. Right now, our members in the Department of Juvenile Services almost universally are echoing a sentiment to us that they feel like they're doing more work with less. They've seen in many instances, and we look forward to working with the new administration, but they really have inherited a situation here where many of our members are working multiple jobs, both in the department because of vacancies there, multiple jobs outside of the department because unfortunately, salary increases haven't kept up. Between 2008 and 2018, there largely weren't many increases. So that decade of stagnant wages has left a situation where many of our members' salaries now are still uncompetitive with neighboring states doing similar jobs and certainly in local and federal government. So we're seeing these staffing issues. It's increasing overtime costs. I think that was marked on the budget again. And it's really impacting the ability for the programs to happen in juvenile services like our members would like to see. Oftentimes those are the things that have to go first when you don't have enough staff to be able to properly invest in those situations for our youth. So we very much appreciate that the negotiated increases for the resident advisors were included in this budget. We do think that the staffing issue is larger than just our resident advisors. All classifications are really impacted by this. And so we would appreciate some support on increasing the salary investments for members in the department. We think that's really going to be important in order to staff and make all these great programs that we hope to work with the secretary on. If I can just one more point, with the strategic planning, we just want to put a marker down that we would very much like to be stakeholders in that process too, as the exclusive representative. Our members really have firsthand knowledge on what they would like to see for many of these youth. They spend so much time with them, and we hope to be included in those discussions too. Thank you.
Thank you. You actually answered the question I was going to ask you about strategic planning and what your thoughts were on that. It's good to see that the secretary is interested in doing some strategic planning. Hopefully you all can get together and have a conversation about what that really looks like. Have you had an opportunity to talk to them about the staffing concerns and things that you think might be helpful with staffing?
Not yet, but we hope to soon. I know after the budget hearing on Friday in the Senate, we appreciate the acting secretary very much for coming over to our member who was able to testify there, and I think they had the chance to speak a little bit. We look forward to the discussion. I think on the facility, realignment plan, strategic plan, look, there is a lot of facility space, right? And I think if you look at, the issues we're having across DHS, across the mental health issue, I think our interest is just making sure that we're maximizing all this facility space that we have. And then, of course, that we're, using state employees to run, the programming there. So,
Thank you. Any other questions? Delegate McCombs.
At Cheltenham, we lost a very fine lady several years ago. It's probably longer than just several years ago. And I was wondering, does the staff that you interact with through the union, are they concerned about security at the different facilities? And is that something that you're going to represent to the secretary and to the new administration, the Moore administration, that's important to make sure that the employees feel protected? If you please elaborate.
No, I really appreciate the question. Thank you, Delegate. Absolutely. I mean, safety issues are one of the core things that as a union we fight for, that our members fight for. I think staffing has a big part of that. If staff are working 16-hour days all the time, you can't be as alert, as you would want to be in a situation that can be, tense. I think it's staffing, not just in residential and direct care, but also looking at staffing for like our psychologists, right? Making sure that we have enough mental health supports in these facilities too. And then there's physical infrastructure, right? I think all of those go together. We do have negotiated language in our contract on establishing health and safety committees, establishing workplace violence prevention programs within the department. I know we haven't been able to negotiate a workplace violence prevention program with the Department of Juvenile Services yet, but we hope that that's something that we would be able to do with the new administration. So we certainly hope that if, we would love to have partners in fighting for health and safety too. I really appreciate the question.
Thanks. Delegate Acevero.
Thank you, Mr. Chair. Just curious, coming back to the salaries point, as to where we compare as to other states, how are salaries comparable to neighboring jurisdictions, I would say, when it comes to this kind of a work. I'm curious, and what kind of a work is being done right now. I know there is a good bit of surveys, just talking about this previous administration over the past 4 years, right? There was some surveys, can you just provide us with an update as to where that is? Because I'm more so all important points, but, salary, sure. Right?
Yep. And I'd love to start, if it's okay, at least on, where our members are. Again, really going to 2008, right, to 2018, many of our members, I think in that time period, were about 9 steps behind. In the same time, their COLAs didn't keep up. So cumulatively in that period, it's not an exaggeration to say that our members were, between 25% or so behind in the raises that they were supposed to get in that time period. Then, you had, hiring freezes happen in many cases. So that, impacted, the ability for agencies to staff up during this pandemic. There have been some recent increases, but they don't overcome essentially a decade of stagnant wages. So if you look at, using a classification in, let's say, in the trades, right? One of our building trades positions, oftentimes now their salaries are going to be lower than comparable jobs that even happen in local government, that happen in federal government. And that really is, again, in large part because, state salaries have stayed, largely stayed stagnant for 10 years. What we would like to see is, an opportunity to take, lift, certainly for the folks that have been employed in state service and have been, around for, 10 plus years. There's a big chunk there that, needs to be brought up so that their salaries, match where they need to be for today. We're doing work on, the bottom of the scale to make sure we're bringing it up. We're doing work, on the top of the scale. But I think what we're really leaving out is the work for the folks that have been around for a long time that are now seeing new folks come in and make as much as they are. So it's not an exaggeration at all to say that our members, who have been around for, since 2008 at least, or at least since 2010, their salaries are, 20+% behind where they should be inflation.
Thank you. Any more questions for this witness? If not, thank you very much,
Thanks.
Denise. Always a pleasure seeing you. That will end Tanika Hernandez, are you here? Wasn't able to come. Gotcha. All right. Well, then that will officially end the hearing for the Department of Juvenile Services. We'll now turn over to Department of Public Safety and Corrections, and we'll have Mr. Jacob Cash give our analysis.
Thank you, Mr. Chair. As you mentioned, I'll be going over the DPSES corrections analysis today. Starting on the cover page, the overall budget allowance for fiscal 2024 is $945 million. That represents a 3.5% increase of about $32 million. beginning with the performance evaluation on page 3, you can see that the inmate population decline that we've seen over the past decade has reversed course. And Exhibit 1 shows that in fiscal 2023, there's been about 450 additional offenders when you compare that to the 2022 actual levels. Exhibit 2 compares the previous trends before COVID to the current trends. Since we are increasing, I was curious to see when we would meet the rate we were at before COVID. And according to this very rough analysis, that would be about 2.5 years from now, where the population would be back at where we had expected before COVID ever happened. Exhibit 3 shows the inmate population by age group. And going right nicely off of the previous analysis, the group of offenders under the age of 30 has decreased by half since 2013. There's about 4,000 inmates that are under the age of 13 in July of 2022. This is a point-in-time snapshot, and that's about half of what it was in 2013. It makes up a smaller proportion at only 27% compared to about 37% in 2013. So Maryland has done very good at reducing the number of young people that are being kept in correctional incarceration. The average length of stay, though, has increased. Exhibit 4 on page 7 shows that since 2014 there was a steady incline, but that really escalated during the pandemic. And in 2021, the average length of stay was over 8 years. It's still currently over 8 years, but it is slightly down over that peak in 2021, which was mostly because there were many fewer short sentence inmates in DPSES facilities because of the court processing during COVID. And as that population has picked back up, the average length of stay has decreased. Exhibit 5 on page 8 shows the inmate population by their sentence length. The department's main population are those with 15 or more years to their sentence, including life sentencers. You can see that there is a couple of different sentence lengths that are much smaller in population, and that's because the state doesn't typically take inmates that are below 1.5 years in sentence. Those are typically for the locals, but since we do take responsibility for running the Baltimore City Jail, there are those offenders adding to that population. Exhibit 6 on page 9 goes into the assaults at correctional facilities. Last year, they went below the offender-on-offender assault goal for the first time in 5 years, but in 2022, they went back over that goal. So there's some improvement to be made. Particularly, there have been some more high-profile events happening in correctional facilities. And this is not including detention facilities, but that also extends to the detention facilities that we'll be reviewing in a few weeks from now. Exhibit 7 on page 11 begins the budget discussion, and the overall allowance, like I mentioned at the outset, is $945 million. Most of that goes towards personnel, and most of those personnel are correctional officers. And there's a large portion of the budget that goes towards inmate medical expenses, mostly the contract with Corizon for the overall inmate medical care contract, but this also includes dental costs and pharmacy costs. And dental costs have gone up because of inflation over the past 3 years, more than some of the other medical costs have. That brings us nicely into Exhibit 8, which is the Where It Goes chart beginning on page 12. And this breaks down the budget change from 2023 to 2024. Like I mentioned, that is a $32 million increase. About a third of that increase is just because of health insurance. That's not something that the department controls, but it's really dependent on the health insurance market at any given point, and that adds over $9,000. There's also a reduction associated with positions transferred out of this unit into other units, mostly going towards the administrative units, and that's something to note that I'll be going into for the administration analysis, that the investigative and intelligence division has a much larger position complement now and additional responsibilities. But some of those positions were sourced from the corrections unit. Other changes that you can see are $5.6 million increasing for food and dietary supplies. There is a new contract for the department with Aramark to provide commissary services and food. That's what the main cost increase is associated with. But overall, they're expecting that this contract will help to control the amount that they're spending each year. The other changes that I wanted to highlight include $3.5 million that is added to this budget to outfit regional mailrooms with enhanced contraband mitigation systems. The department ran a pilot program at one of the facilities on the Eastern Shore, and that was deemed successful. They reduced the amount of contraband in those facilities, and they're expanding it to the other regional mailrooms. Moving down towards the personnel data section, which begins on page 14. The number of positions, like I mentioned, declined by 14. Most of these go to the Office of the Secretary, and that's a reduction of $1.7 million. I'll also point out there that the vacancies are currently above the budgeted turnover by 35 positions, and that would be associated with a few $1 million in savings if those aren't filled by the end of the fiscal year. In Exhibit 9, it breaks down where those vacancies are by classification. In terms of overall numbers, most of the vacancies are correctional officers. That's most of what the staff are, but they actually have a much lower vacancy rate than the other classifications in this division. I would point out that correctional dietary officers and maintenance officers, the main ground level operators of those positions, will not be receiving a salary or an annual salary review grade increase, but the managerial positions in those classifications will. And correctional supply officers will also receive an annual salary review grade increase. I'll also point out that there's about a quarter vacancies at Maryland Correctional Enterprises, and that informs some of the issue discussion we'll go into in just a moment. So issue 1, which begins on page 16, begins the discussion of the department's overall staffing needs. So the previous vacancies I just mentioned were only for this unit. This issue expands that to consider all the correctional officers in the department, which also are hired and operate the detention facilities in Baltimore City, as well as there are a few correctional officers in various administrative units that help do special operations across the department facilities. Exhibit 10 on page 16 shows the number of correctional officer new hires each year. And from 2009 to 2015, they were substantial and enough to overcome the attrition rate of the department. But beginning in 2016, there was a new hiring process rolled out, and that dramatically reduced the number of correctional officers that were hired. The department has improved that rate, and in 2020 and 2021, they hired more people, more correctional officers than separated from the department. And Exhibit 11 can show you the cumulative effect of these trends over the past 8 years or so. Since 2014, they have built a gap between where correctional officer staffing was and where it is now. And it's on the increase again in 2022, since there were more separations than hires. According to the staffing analysis, they would have to fill more than just this gap in order to adequately staff facilities. The staffing analysis was completed in September of 2022, and DPSES did transmit those preliminary results to DLS for our analysis. In Exhibit 12 shows the results of this. In the Department of Corrections Facilities, which is more pertinent to this budget, as well as the department, or the Division of Pretrial Detention and Services, would need a combined total number of CO1, CO2, and sergeant positions over 7,000. They're currently only at, well, they're currently about 3,000 less than that, or about 2,500 less than that. If you include vacancies, about 3,000 less than that. So if all these 2,500 new pins were added, which that's not happening right now as far as this budget is concerned, they're not being added. But if they were to be added, it would be approximately $185 million. At the more standard turnover rate for the department, that'd be about $160 million. So far, the biggest concern, the biggest budgetary concern with all these vacancies has been overtime costs, and coincidentally, those are at also about $160 million. They're over $160 million in the fiscal 24 analysis, or in fiscal 24 budget, and that number could go up if the department doesn't fill their vacancies. Now, there also are some concerns that DLS has had with this staffing analysis. First, there was a change to the way that the relief factor was calculated, and leave usage was much higher during the pandemic. So it's possible this is overstating the number of positions they need, especially if leave usage goes down in the future. It's also, we weren't able to completely line up the number of funded positions to the amount that we have on our books, and so there was concern that we weren't counting the same positions or the same need of positions as the staffing analysis indicated. And third, there's differences between previous staffing analysis, the way those, the methodology of the previous staffing analyses compared to this one. And Exhibit 13 compares those previous staffing analysis, which presents the overall need for correctional facilities, excluding detention facilities. The 2017 study only considered general posts, but in the 2019 and 2021 study, they considered special assignment posts as well. Between 2019 and 2020, there was only a 0.8% increase in the number of positions that the department required, but at the same time, the average daily population declined by over 15%. And while generally, on the whole, the facilities that had a population decrease also had an estimated decrease in needed positions, it wasn't quite as in line as we would have expected. So in terms of how accurate the results of the staffing analysis are, I think more time is needed to fully analyze it and see what the department's needs are for a fully adequate correctional officer component. We're asking the department, in terms of this issue, to comment on that staffing analysis and the number of positions that are required, as well as the steps that they're taking to improve the working conditions in facilities, reducing overtime, and to continue to evaluate their staffing needs. We're recommending budget bill language of $200,000, or restricting $200,000 pending numerical hiring goals, not just for correctional officers, but extending to community supervision agents and all of the other administrative staff for the department. And DLS is also recommending to restrict $100,000 pending the second of 4 quarterly hiring and attrition reports. And we are also recommending that the amount that was restricted from 2023 be released at the conclusion of these budget hearings, since that was submitted and was used to inform these analyses. The second issue today is correctional education. And this is something that we haven't discussed that much in the budget. It is a program operated by the Maryland Department of Labor. I'm fairly certain that in 2008, the responsibility was shifted from DPSES to MDL. MDL staffs it, and all of those staffing resources are budgeted in MDL, but there are equipment costs and other costs that are budgeted within DPSES. There's about $3 million in 2024 for equipment and other material needs of classrooms, but there is also 4.6 budgeted for correctional education instructors, and this is a $2.4 million increase over what is typically budgeted for this need. That increase is directly related to an effort to permanently hire contractual staff from various community colleges as Maryland Department of Labor contractual FTEs. That conversion is expected to not only increase the amount that they're paid, but also provide them with more permanent staffing situations so that classrooms do not have vacant teachers, or at least that they don't have vacant positions for very long. Exhibit 14 shows some of the effect of having low staffing for correctional education, but also broadly the impact of COVID-19 and recent trends. There was a pre-existing trend of decline in enrollment before the pandemic, but it truly accelerated during those years. and in 2021, correctional education enrollment bottomed out. Occupational enrollment also bottomed out, and it has not yet recovered, while correctional education is increasing. And just briefly, correctional education is more high school and college levels, while receiving degrees, while occupational programs are more certificate programs, trainings, whatnot. And students can engage in both. They can also just do one or the other, and they can do multiple certificate programs as well. Exhibit 15 shows the achievement of certificates and diplomas for correctional education students and occupational students. From fiscal 2017 to 2018, it was pretty high, but then during the pandemic, it quite dipped. Only 4 students received high school diplomas in fiscal 2021. That did increase to 171 in fiscal 2022, so enrollment or achievement is improving, but it's still about a third of the levels it was prior to the pandemic. And that's something that is a shared responsibility between MDL and DPSES to encourage enrollment and achievement. I'd also, in terms of correctional education, want to bring your attention to an educational tablet initiative, which is putting tablets in students' hands at these schools. But there's also a personal tablet initiative, which is providing free-to-use tablets to all inmates that want one in DPSES facilities. These are curiously being provided free of charge to the department, and they're preloaded with a variety of free software, which should be very helpful to the inmates, including educational tools, career tools, self-help tools, journaling resources, as well as free calls to friends and family. But the main concern here is that it's being provided free of charge to the department, and it would be quite costly to do this for the company. And DLS is simply concerned that you could be opening up this program to be reliant on the personal spending habits of offenders, since there's the option to purchase premium content, and that's the primary driver of why this would be free of charge. But we wouldn't want these tablets to be removed if they're not buying enough premium music. Now moving to the final issue, issue number 3, the Maryland Correctional Enterprises, which is the arm of the department which provides working opportunities at a variety of facilities and a variety of business units. Inmate wages range from $1.30 to $9.30 per day based on the industry and skill level, and this was just reworked in the past fiscal year to be a new pay scale. There's also an opportunity, currently 12 individuals are being hired at a market rate for their work, but the majority of inmates are being paid at this range mentioned above for MCE. MCE spending overall for fiscal 2022 is split out in Exhibit 16. Regular payroll was $13.2 million and inmate payroll was $1.8. Most of what MCE requires monetarily is supplies and materials to produce their goods. In Exhibit 17, that's showing that inmate employment dipped quite dramatically during the pandemic, and it is slightly on the decline, but there is a lingering impact of COVID-19, not just on the number of individuals who are, they had to stop working on many of these units, but those have been restarted, and inmate employment is lower because they don't have as many correctional officers to watch over them, and sales are lower than they were before the pandemic, so there's not as much opportunity to keep inmates occupied. And that's something that we are asking the department to comment on and to, provide any comment on whether or not there's a need to increase prices or change their tactics to increase sales volume, especially since many of the products that they produce are for state use in permanent locations, and that's something that the state has moved away from in recent years. With that, If there's any questions, I'd be happy to answer them. The 2 recommended actions are listed on page 28, but I'd be happy to answer any questions that you have.
Thank you, Jacob. Are there any questions for the analysts? All right, there are none. Seeing none, we will move on to Acting Secretary Carolyn Scruggs. And in a few hours, you won't be Acting Secretary either.
Thank you, sir.
Thank you for being here. And please bring up anyone you want and make sure you introduce them as well.
Good afternoon, Chair Bridges. I see Vice Chair Ivy has left, and members of the Public Safety and Administration Subcommittee. For the record, my name is Carolyn J. Scruggs, and I'm the Acting Secretary of the Maryland Department of Public Safety and Correctional Services. With me today are Annie Harvey, our Acting Deputy Secretary of Operations, Christina Lentz, Acting Deputy Secretary of Administration, Phil Morgan, Deputy Commissioner of Corrections, Stephen Saunders, Chief Executive Officer for Maryland Correctional Enterprises, and Naja Roberts, our Chief Financial Officer. The department appreciates its ongoing collaboration with the Department of Legislative Services as well as Mr. Cash. This was yet another thoughtful and very thorough analysis, and we thank Mr. Cash for his work. I would like to begin by recognizing the staff in the Division of Corrections. These are individuals who do incredible work every day. The analysis contains 3 issues for the department to respond to and 2 recommendations. I will start off by saying that we concur with the recommended action. I would also like to note that the department is requesting a change in the due date of the quarterly hiring report for FY 2024 from the 12th to the 25th. DLS has requested the department comment on the most recently released staffing analysis and the estimated number of additional positions required in comparison to previous staffing studies. The staffing analysis that was completed used new methodology known as net annual work hours. This process is more accurate in measuring staffing needs than the previously used method. Basically, net annual work hours allows for analysis based on actual hours an employee is available to work, instead of accounting for work shifts, which are 8 or 10 hours blocks of time. Additionally, factors considered by the net annual work hours were included in our written testimony. The results of the analysis determined that the department would need an additional 2,500 positions to reach full staffing. These 2,500 positions are in addition to the current vacancies, resulting in over 3,000 positions needed. Recently, I was asked what my goal would be in decreasing vacancies in the department. The question prompted me to look into this issue on a deeper level, and as a result, I reviewed hiring trends over the past 8 years. In 2016, as the result of a complete restructuring of the hiring process, the department hired the lowest number of correctional officers during the past 8 years. That was 63. The department also experienced 387 terminations of correctional officers in that same year. In effect, the department ended 2016 with an additional 324 frontline correctional officer vacancies. The department did experience significant improvements in hiring between 2017 and 2022. However, we also continue to experience terminations consistent with prior levels. As such, we need to do more than fill vacancies. We also need to reduce the level of terminations within the department. Significant steps have been taken to address hiring and retention, including hiring bonuses for all new hires and additional bonuses in difficult-to-hire regions. A retention longevity pay incentive program was implemented to retain experienced personnel beyond their initial retirement date. The department has increased its presence in the community, at job fairs, community events, colleges, and universities. the Maryland State Ad Agency was engaged to assist in improving the department with its hiring effort. The department has streamlined the hiring process to include same-day conditional offers of employment. However, we are hindered by some competition with county jails, states, and the federal government. A bordering state is currently offering a $10,000 hiring bonus, putting them on par with our first-year salary for a correctional officer. The department faces the challenges of negative perceptions about the basic duties of the job, as well as the physical plant of our aging institution. Television shows portray corrections in a negative light. Under my leadership as the Assistant Secretary for Programs, Treatment, and Reentry Services, it was evident that citizens hold poor perceptions of our returning citizens. To be successful in recruiting and retaining, incentives are extremely helpful, but it might also be time to address the negative perceptions people hold about a correctional career. A position as a correctional officer includes generous state benefits, retirement opportunities for advancement, and the potential to work in both custody and non-custody roles. And here I set the example of all. For younger generations that are drawn to new job opportunities, a career in corrections could be ideal. After working for a period of time in a custody position, the opportunity exists to transfer to specialty units or to transition to and from operations within our administrative areas. The department facilitated over 400 of these internal promotions last year to retain employees interested in developing a new skill set. Yet, despite the professional opportunities the department offers, we will continue to struggle with hiring until our dedicated men and women are recognized for their commitment and the department is recognized for the professional organization it is. Responding to the other issues DLS asked us to comment on, I will address overtime. The department takes a multifaceted approach in its efforts to address how we utilize overtime. We closely monitor overtime trends and, as possible, implement operational modifications. In terms of monitoring trends and modifying operations, we track the number of staff that are available for duty on a daily basis and on a shift-by-shift basis to make sure our facilities are properly staffed while reducing overtime as efficiently as possible. The biggest strain on our overtime is mandatory overtime versus voluntary overtime. That is when you are told you are not going home. It is part of the mission of public safety. We are always there, but it is tough on the staff who have to do this every day. Therefore, we continue to prioritize the hiring of additional correctional officers. Next, the department was asked to comment on the new tablet program, including steps taken to ensure that access to tablets and electronic resources is not dependent on or impacted by personal spending habits of our incarcerated persons. The department is very proud of the tablet initiative. We've begun rollout in most facilities and will be able to offer a tablet to every individual at no cost. Additionally, the tablets are preloaded with free content, including books, Career One, Khan Academy, GTL ViaPath Help app, Webster's Dictionary, a calculator, education, career apps, religious apps, and self-help learning opportunities, to include the Calm app. Incarcerated individuals are also able to message family and friends at no cost. Also available is the Edge app that now allows the incarcerated population to purchase commissary and check their banking information at no charge. The tablet program does allow individuals to purchase premium media content, including music, movies, and phone calls. Finally, MCE was asked to comment on current efforts to reduce MCE order delivery times, increase sales, and increase inmate employment. COVID had a significant impact on MCE's operations, especially given the challenges presented by disruptions to the supply chain. Although delivery times increased during the height of COVID, MCE is returning to more normal and expeditious delivery times and working with the Human Resources Division to hire and fill vacancies for CDL delivery drivers. MCE continues to utilize technology to track their business functions using the new Enterprise Resource Management System, Global Shop Solutions. They are seeking to improve their capacity to track deliveries in real time. MCE is actively seeking ways to improve their product line, recognizing that improvements can benefit the incarcerated individuals who participate in occupational and vocational training programs as well as their customers. MCE has worked with Human Resources to fill additional positions, including hiring a research and development specialist who will research new product needs for state agencies, better aligning practices with current customer trends and needs. As noted in the analysis, MCE had to deal with price increases of its raw materials due to rising inflation across all product lines and has had to adjust pricing on hundreds of projects to compensate for those unforeseen price increases. MCE has positioned themselves for new projects to begin at the end of FY23 and continue through FY24. Undertaking these new projects allow them to offer increased vocational participation to our incarcerated population. As we return to a post-pandemic environment, MCE has resumed vocational training for over 1,100 incarcerated individuals and strives to expand opportunities to bring on additional trainees. MCE brings on new participants monthly and is striving to add an additional 50 to 100 program participants by the end of this fiscal year. Despite continued obstacles, MCE continues to persevere. They evolve, they review their business plans, and they provide some very essential workforce development skills to the incarcerated population. We thank them and their staff for what they do. Again, we concur with the recommended actions and are certainly ready to answer any questions you may have of us. Thank you, sir.
Thank you. Thank you very much for that thorough response to the analyst questions. I do have a couple of questions that I wanted to ask. Along the lines of staffing, I believe, and I should have asked the analyst this, when we were talking about the vacancies, one with correctional dietary officers, I believe there's a study to look at increasing salaries for management, but I didn't hear anything about like staff along with that.
So one of the things that we did do is we looked at our entry-level positions. So we have increased our entry level for individuals coming first time into our department. However, one of the tasks that I have before me is to look at the equity of salary for those that are already here.
And it's just for the correctional dietary officers, or is
it's for the correctional
across the board?
series? So the correctional series includes dietary officers, supply officers, correctional officers, maintenance officers. It's anyone in that correctional series.
Gotcha. Okay. And another question I had was about cost increases for the Corizon contract. Is that contract? I know we've talked about this a couple of times over the last couple of years. Is that contract up for renewal anytime soon, or when is that?
Thank you for that question. So they are no longer Corizon. They work now under the name Yes Care. Is their new brand name that they started last year. It was a name change that they did. That contract ends December 31st of this year, and we have already begun to review scope of work and other things related to placing a new RFP out. We just brought on last Wednesday a new chief clinical medical director. So he is going to be essential in helping us with that. And the new secretary for Maryland Department of Health, I've already worked with her, and she is helping us to review that as well so that we can get it out for bid.
Okay. Thank you. Any other questions? Delegate Acevero.
Thank you, Mr. Chair. Welcome, Madam Secretary.
Thank you.
Congratulations.
Thank you.
Certainly looking forward to working with you and your team. Want to also point out that you are a veteran of DPSCS, and it is good to see someone, with your experience and years with the department in the position that you're in right now. So congratulations. And to your point in your testimony about just showing folks that there is a career in public safety and corrections, I mean, you are certainly testament to that.
Yes, sir.
And so getting to, the hiring and retention, which was something you mentioned in your testimony, I'm curious as to, because, we're talking salary, et cetera, and I certainly agree that we need to certainly pay correctional officers in the state of Maryland more. Just be frank, we need to do that. I come from a county where correctional officers do make more compared to state correctional officers. It's very blatant. Some needs to be done. We got more funding. My hope is that something will be done. So, but what about safety and how safety factors into whether people stay on a job, right? Occupational hazard, right? I don't think any of us would be in this position as long as we are if, there were certain safety concerns, not that there aren't, but certainly safety concerns associated with being in that position, right? So would you agree that, safety, particularly for correctional officers on the jobs and, folks that work in DPSCS, is a factor in not just hiring, but also retaining folks as well? Because there are some folks who will just leave just because, listen, what y'all paying me and the safety situation that I'm in, it's just not worth it. Would you agree with that?
I agree to an extent, sir. I agree that safety is a concern. However, I think there are also mechanisms that we have in place that teach them how to work in the unsafe environment that we currently have to thrive in, and that if we are more conscious and deliberate about how we handle ourselves behind the wall and how we manage that population, we then contribute to the safeness of that entire environment. So some of it is changing the culture to make sure that it's safe. You're already trained in the academy through defense tactics and safety operations and just how basically to be safe. Look to your left, look to your right, look up, look down. Know your surroundings is basically what we're told. And we have to then convey that to the public so that they then understand that, yes, you may feel unsafe coming behind the walls with us. We're not the police officer with a gun on the street. We can't carry weapons. But there are ways that your behavior can keep you safe behind the wall. And just how you carry yourself and your integrity with that incarcerated person will make things a lot smoother.
Sure, and I completely agree. And so to what extent is the department doing all that it can to ensure the safety of correctional officers and really employees, right? So sure, safety falls on the employees following, the SOP, your training, etc. But safety, there is some measure of responsibility that falls on management, administration, and the agency. So I'm curious as to the extent of, what the agency is doing to ensure safety of those correctional officers.
So I would answer that in saying that I think there is more that the department can do. I think that the department needs to focus more on training on confrontational avoidance. They need to make sure that individuals know how to de-escalate situations so that there is not confrontation. So we are going to work with the academy, with the Correctional Academy, to make sure that we have modules not only for those coming in, but during in-service to ensure that that's safety. And then it has to be reiterated within our facilities by our wardens and our AWs and our chiefs. They're going to have to be visible because that makes the person comfortable. They're going to have to walk those facilities, know that those facilities. And then the other part of that safety is our aging infrastructure. Right now we are doing, at least during my career, a lot of patching up of things that are broken. So we have to look at how do we get those things repaired so that we can make individuals more safe. And of course, it's budgetary. We've got to get the funds to get some of those things done.
One last question. I'm brief. Thank you. Appreciate it. One last question. I'll make it A and B. And I appreciate the response. The next question, real quickly, is if I have a family member that's currently incarcerated, and I were to call, or they were to call me, right? Is that something that is contracted out, communication?
So right now, we have GTL, if you're using the phones. GTL is a contract through us, but we have our tablets now where they can do the free.
Right. But if they choose to,
If they choose
if they
to,
don't have
can
those tablets,
correct.
right, or aren't able to utilize that technology, right, because you can have it and not know how to use it,
The phones are still available.
and there is a charge.
There is a charge. Yes.
Who pays that charge?
I'm not sure. Is it on the? Inmate pays for it. Inmate's
The
paying
inmate.
for it.
Okay. So we'd love to follow up with you just on that. And this last and second to last question, I'm done.
It's okay.
Women's Pre-Release Center, right? Can you provide us an update? I understand you're new on the job, right? Would certainly love to find out, would certainly love to get an update as to one, whether it's on your administration's radar, and what do you all plan on doing that? Because, I mean,
Yes, sir. It is on our radar, and we are actively engaged in getting that done. We're working with DGS. DGS is actually leading that effort right now. It's in 3 phases. When we last met with DGS, they were looking at the zip codes related to those young ladies where they're going back home to, so that we can identify location, we can identify spacing needs, housing needs, programming, dietary. So we are on board with that. And if I can go back to answer one of the things that just came to me, when you asked about security, I did want you to know we are upgrading our camera system right now throughout the department. So every camera within every facility is getting a total overhaul right now. And that's going to assist with safety as well.
thank you very much, Mr. Chair. Appreciate it.
Thank you, Delegate Acevedo. One question means one question. I just let you keep going
one more
sometimes.
question. So. Follow up.
Right. Mr. Vice Chair, Delegate Chang.
Thank you very much, Mr. Chairman. Good afternoon, Madam Secretary. Scruggs, thank you for being here and your team being here this afternoon. I have a few questions for you, if I may, Mr. Chairman. First question is, in the analysis we saw about the new inmate mentorship program. Could you talk about that a little bit for us?
The new inmate mentorship. Oh, are you talking about the peer recovery program?
It's listed as new inmate mentorship program.
So I would think that it's the peer recovery program. So we started last year a peer recovery program at the Jessup Correctional Institute. We graduated 40 individuals from that program, and 26 of them are now sitting for certification to be a peer recovery specialist. The goal was to assist us with our individuals that may suffer from some form of addiction, and to utilize those mentors, those incarcerated persons, as mentors for other individuals. Last year, July 1 of last year, we brought on GEO and West Care as our substance abuse contractors, so that they could begin a substance abuse contract within our department. We had not had a substance abuse contract since 2014, approximately. And they are going to work very closely with those 2 entities so that they can provide levels of care, from the lowest level of care to whether or not that person is in a high level of therapeutic care and needs medically assisted treatment. So that's what those mentors are.
Great, thank you.
Mr. Vice Chair, if I may, it looks like this is a different program, though. This is a program that gives new inmate, gives individuals with life sentences who have 10 years or more seniority and already perform team leader tasks the opportunity to mentor and train beginner inmate workers.
That's MCE. So I'm going to ask Mr. Saunders, please respond to that.
I will.
Please come up.
Thank you. All right, so this is a new program. All right, thank you. This is a new program aimed at those with the life sentences. Now, not because you have a life sentence does not necessarily mean that you're not going to be paroled, just to make that clear. So these folks have been around, they have the most experience and sometimes the most influence over those that are coming on board. So the idea is to take those that we consider now as the team leaders and give them an opportunity if they would like to be a mentor. So they would be responsible, they'd have other responsibilities, be paid a greater salary, and then others that left or those lead positions could be backfilled by others who had the aspiration to be a leader. We broke down the old classification system into team member and team leader, and now we're adding the mentor. So these folks will be able to give back. They will be paid a lot more money than anyone else on the floor and present an opportunity for those to aspire, like it is on the outside. We want them all to have an opportunity to do something more. With the team concept, they don't just learn one job. If a team is 11 or 12 positions, they have to learn everything within that team. A leader has to be responsible for every position in that team and bringing in the raw materials, understanding what we need, what we don't need, and communicate directly to the civilian staff. And they meet on a regular basis. So they have the input that they never had before. So we're really trying to emulate what you see outside the fence. And that is where they get their confidence. I would invite you to visit us and listen to these men and women tell you about what they do. It is not only inspiring for me, it just makes what I do for a living that much rewarding. So that's what the mentorship is.
Mr. Chairman, thank you so much for guiding to that program and actually segueing into MCE. It's really an honor to serve on your MCE Management Council, and I've served in it for a couple years. And actually during this last meeting we had virtually, there were a series of testimonies, just really how it's life-changing programs that have been provided at MCE, and how one of the testimonies was an individual who is now out and just really doing really well and has as a part of a really thriving business. I think that really shows just the strength of the program and how important the program is. And with regards to the mentorship program, any idea how many mentors and mentees we have currently?
The target is 150.
Okay, right. And during the last discussion virtually with the Management Council, there was the discussion about what's currently branded as the MCE, but one of the topics that came up was possibly renaming it as the Maryland Reentry Enterprise. And maybe that's something we could think about in the future, if that's possible. And also Mr. Chairman, during the council hearing, I had actually offered that if it's maybe after session that the committee could go out and take a tour of MCE, the facility over there. I think that would be great. If I may, one last question, and disregarding the Women's Pre-Release Center. Thank you so much to your staff. Actually, Ms. Beskid and also Ms. Cal provided information for me to provide to a forum we had a couple weekends ago, and it was very helpful, and the dashboard was a very useful tool in providing that to the community. And the question I have is regarding the capital program for the pre-release, women's pre-release. There was money that was allocated, appropriated last session for the facility, and where does that stand right now? I think there was some clarity that would need to be provided.
Correct. My understanding is that there was an oversight and that line item was missed from the budget, but we are working with DBM to do a supplemental so that that money can be put back.
Great. Thank you very much, Madam Secretary. Very much appreciate it. Thank you, Mr. Chairman.
Thank you, Mr. Vice Chair. You can ask as many questions as you want. Are there any other questions? Delegate McComas.
I think idle hands are the devil's workshop. And I guess several years ago, with the Judiciary Committee, we went out, and I can't tell you exactly which institute we saw, but we saw the one where we saw the beekeepers, and I honestly thought that they were actual beekeepers that were outside of the facility as opposed to in the facility. And I mean, they were very happy. And then I saw, I think one of them that was a beekeeper was in the, I guess, is it the graphics? Mm-hmm. One of the departments that they do, I think they do like plots or
Graphics
whatever.
design.
Yeah, graphic design, and they had their cat with them. And I'm like, so, and then we got to see some of the folks that were training dogs for folks that might be blind or anything. Anyway, I was wondering, have you been able to expand that program? Because it seemed like everybody we met, now I realize, it was a legislative committee, but everybody's on their best behavior, but I think they genuinely were happy folks. And
Yes. That's the Maryland Correctional Institute for Women. And we offer an abundance of programs there. The graphic design department is there. The furniture that you see before you, many of the women are learning how to scope that work out and do that. Our flag shop is there. We continue to make sure that we offer the women the same occupational skills and training opportunities that we're offering our men in our men prisons. We recently brought a hospitality program certificate through Department of Labor to the Women's Correctional Institute. So yes, we are continuing to expand, and we want to grow that even more because that helps them with successful pathways back into the community when they get those certificates, and we can connect them to workforce opportunities.
can I just ask one other quick question?
Everybody wants one quick question.
Yeah. Have you been able to increase the salary for the folks that work for state industries or state use industries, that get paid different salary
MCE.
amounts? Because I know that some of the legislators historically have been very concerned that they feel that they're not really getting a fair value for the work, because it's like maybe $1 something or other, sometimes depending on the jobs, $1 and something per day or maybe per hour, but it's very low compared to. So I just wondered if you could comment on that.
The answer is yes. We met with many of the delegates and legislators to discuss this collaboratively with the Department of Public Safety and the education system, because we are part of a reentry program. We are not only MCE, we are part of the whole. So since that meeting, we developed a 3-year plan to increase the program participant salary. Right now, we've increased it 111%. We have another proposal that we're going to put before the Management Council for review and approval to increase it even further. Our goal is to be the #1 in the nation for compensation in this area for the program participants. They are valued. They learn. The proof is what happens in reentry. We're very happy to see that those activities are doing what they're intended to do. So the answer is yes.
Okay, thank you, Mr. Chair.
Thank you. I do have one last question, like everybody else. In terms, we mentioned earlier the staff leaving or the correctional officers leaving and going to other places. I'm assuming that we're tracking where those other places are, and if so, would you be able to break that down for us if they're going to a specific county, if they're going to a specific correctional facility out of state? Is that any information that you would be able to provide for us?
To the extent to the exit interviews that we had, because I know those are occurring in some of our areas, yes, we'll be happy to get you that data.
Thank you. Yep, definitely appreciate it. And with that, there are no more questions, okay? So thank you very much for being here. Look forward to you getting confirmed as the secretary, not acting secretary anymore.
Thank you very much.
Thank you.
Thank you all.
Appreciate you all for being here.
Delegate Chang, thank you.
We do have public testimony as well. And so we have at least 5 individuals who are coming up for public testimony. Again, for public testimony, you all have 2 minutes for public testimony. We're going to start with DeJuan Burton and Ashley Devon Johnson from Out for Justice. If you're here. Oh, maybe not here. All right, one last time, DeJuan Burton and Ashley Devon Johnson. All right, we will go to Matan Zemer. Jews United for Justice. My apologies if I said that wrong. I'm sure you'll
you got it right
correct
the
me.
second time. Absolutely.
All right.
Thank you, Chair. Thank you, Vice Chair. Thank you, Vice Chair, as well, for being here. My name is Matan Zemmer. I'm a Maryland community organizer with Jews United for Justice, which organizes more than 6,000 Jews and allies across the state. I'm here today in our role as a partner in the Women's Pre-Release Equity Coalition. So I just want to start by saying thank you so much for raising the issue in today's hearing. The questions posed are exactly the ones that we have, so I won't belabor the point, especially since we've had many questions today. But I want to underline a couple things because I know you all have heard about this issue for a long time. We have the Gender Responsive Pre-Release Act on record now that has clear requirements and timelines. There have been continuous delays in implementation. We know some of those were as a result of the previous governor's veto, but we've seen subsequent delays in reports and progress. But we're encouraged to hear that there's some new information coming out of DGS and DPSCS. We were, as everyone was, surprised by the pre-authorization of that $2 million not showing up in this year's budget. So we're encouraged to hear that that's getting fixed. I do want to note that we have heard from DGS that they're expecting that the next phase of implementation will actually cost $5 million, and that's what they need to move forward. So we just want to highlight that I know that that's more of a capital budget committee question, but just wanted to pose it here since you all are discussing this issue, that if it is $5 million, we hope that that's what will be put in the budget so we don't see further budget-related delays. So we'll be following up on that and hope to partner with you on that. A couple other quick things. We really appreciated all the reporting from Mr. Cash and the details that are put there. I think one of the examples that's in there is on page 26, the note that currently only 5 women have been involved in off-site programs. And I think that that's the result of COVID, but I think it also points to the opportunity that Women's Pre-Release offers, right? It's about giving women who are incarcerated meaningful opportunities for access to programs and resources so they can re-enter their community successfully. And it's about decarceration, because if that happens, we'll see a reduction in the population. And that's what we're fighting for, and we know that you all are fighting for as well. A couple other quick notes just to have on your radar. We've been told that the capital improvement plan is supposed to be updated. So far it hasn't been updated, so we're keeping an eye on that. There was also a report that was due from the Falcon Consulting Group that was looking into the planning process. That has not been made available as of yet that we're aware of. And then the other thing, we work alongside quite a big coalition of organizations. It's led by Out for Justice and the Maryland Justice Project. And unfortunately, they couldn't be here today, so I'm honored to be here and representing the coalition. But they are absolutely the leads, and we're following their lead 100%. And they have continuously proposed to the department that they want to be partners in this process. And so in the next phase includes things like community surveying around the proposed locations. And they've said again and again that they want to be a partner in that, right? They're connected to folks, and they want to be in the process. So just reiterating that, I know that the General Assembly is appreciative of that. We want to see that carry over with the new leadership and the new administration. I think that that's really all that I want to highlight, because I think that your questions got at what we were calling for. It's the tireless advocacy of these organizations that we get the honor to work with that has moved this forward. And we'll keep fighting to make sure that it's a reality. And we just really want to see it fully funded so that we don't have to come back year and a year again to fight for just the next phase of funding, right? We want to see a commitment that this is going to move forward and in a timely way. So I appreciate that. I appreciate the committee's time.
Thank you. We appreciate you for being here and all your advocacy as well. Are there any questions? If not, thank you again. Definitely appreciate it. Yep. And now from ASME Local 1678, we have A.C. McCabe and Farouk Idris. And if I misstated your name, please correct me. Thank you both for being here.
Good afternoon. My name is Farouka Idris. So you said it correctly earlier. All right. My name is Farouka Idris, and I work for the Department of Public Safety and Correctional Services. I currently work at MCIJ, which is Maryland Correctional Institution Jessup. I've been there for 10 years, and I'm also a member of Local 1678. At my institution, officers across all 3 shifts work every day, 16 hours, leading to officers' burnout and safety concerns. I was a member of the recently completed staffing analysis, which was a 15-man team, and the shortage is across all institutions in Maryland. However, the need to do more for middlemen just like me, who have been in the department for 10 years and have witnessed newer officers coming through the door making more money more than myself, with higher steps, incentives, bonuses, and retentions, would be great and beneficial to me. However, we do not think it will be a great decision or a solution to the hiring process to hire 18-year-olds or 19-year-olds officers due to the safety issues when dealing with the incarcerated. And we also are very anxious of what will happen when officers who signed up for the retention or longevity bonuses a couple of years ago leave the DPSCS in 11 months. And it says it would definitely cripple the department, because majority of the state's officers have actually said they will not be renewing it coming next year. Filling these 3,000 vacancy pins would ensure the safety of officers and the incarcerated and enhance rehabilitation. And just to think about the contracted fees for the incarcerated, actually, the quality of the food that is being given to these men is really low. And as the saying goes, the way to a man's heart is through his belly. So thank you.
Oh, thank you very much. You are absolutely right. Ms. AC McCabe, did I say that correctly? AC?
AC, it's Arpa Diana, AC McCabe. I work at ECI. I've been there for 12 years. I've been 12 years with DOC. I'm a case manager. I'm a correctional case manager, and we don't get mentioned in anything. We are part of the classification of the correctional officer, yet we are never mentioned in anything. Just something that we do, we are part of the whole part of an incarcerated person, life behind bar. We put them in programs, we put them in education, substance abuse, legal issues, release planning, you name it. There is no movement in an institution without case managers. Our numbers have been short. We are getting back to it now. Unfortunately, we are losing a lot of people to other departments with better. They're getting bonuses that we are left out. Everybody in our classification is getting them, but us. The biggest issue that we're facing right now is we have been working at least 130 extra hours than anybody else that they have been unpaid due to an unpaid lunch that is not possible for us to take. Everybody else in our classification has a paid lunch, so what happens every single day, we end up working extra 30 minutes. You can't leave. You have to be there for the inmates. We don't want to leave. We want to make sure they get the programming they need. We want to make sure they're successful leaving. They're not coming back. That's where the problem lies. When they come back, we fail them. We don't want to fail them. Extra 30 minutes every single day. We are there for free. We are over it. We are very, very overworked. This would be such a little thing to do for us to create morale, to help us help them. It's a stroke of a pen. It doesn't cost the state anything, not a single penny. Yet here we are 3 years later still begging for the same thing. We are trying our hardest not to file for overtime every single time we get our unpaid lunch, but we're going to have to. That's going to affect the budget tremendously. We don't want that. We want the services to go to the inmates. Thank you so much. I appreciate it.
Oh, thank you. Thank you both for the work that you're doing for the state and for the inmates within the facility as well. I do have a question. As a caseworker, what is your average caseload?
We are going between 200 to 300 per person. And that's on a good day.
Okay, yeah. Are there any other questions? All right. Thank you both for being here.
So
Definitely appreciate your time. Thanks again for all that you do.
Okay.
All right, so that will end the budget hearing for the Department of Public Safety and Correctional Services. We will now turn to the Maryland Department of Energy Management. and Budget Analyst Samantha Tapia. You stepped out. Okay. You want to? Actually, we'll switch it up and go to State Archives. And Jacob Polico will give our analysis. If you'll excuse me for 1 second, I also need to step away, and so the vice chair will take over until I get back. Don't give them too much. Talk as long as you can, and I'll be right back.
Okay, thank you, Mr. Vice Chair. Don't get to say that too often. Happy to be here today to talk about the State Archives. The State Archives is Maryland's central depository for government records of permanent value. The State Archives retains information from all three branches of government, and it is one of the largest state archival organizations in the nation. Holdings kept in the State Archives date from the state's founding in 1634 and include key documents such as Maryland's executive, legislative, and judicial records from both the colonial and state eras. Other items include state and county publications, reports, and probate, land, and court records. Additionally, the State Archives contain business and church records, as well as collections of maps, newspapers, and photographs, along with the private papers of select individuals. Additionally, the State Archives maintains custodianship over more than 3,500 paintings of value and other works of art owned by or loaned to the state. The State Archives also provides for the acquisition, preservation, and proper care of these items, covering more than 400,000 cubic feet of materials. In the fiscal 2024 allowance, the budget increases by $932,402, or about 9.5% to $10.8 million. And as we see in Exhibit 1 on page 2, personnel occupies most of the fiscal 2024 allowance at 70%, or about $7.58 million. Fixed charges, contractual personnel expenses, and additional and replacement equipment are other significant categories in this allowance. Turning to page 3, we see once again that the fiscal 2024 allowance grows by about 9.5%, or $932,000. The largest personnel changes are increases to employee and retiree health insurance, going up by about $205,000. The annualization of November's 2022 4.5% cost of living adjustment, about $78,000, and new positions making up about $42,000. Other large changes include computer and IT equipment upgrades, coming in at about $420,000, as well as contractual services for archival activities, coming in at about $141,000. On page 4, we have data on changes in personnel figures in fiscal 2024. Firstly, the fiscal 2024 allowance adds one new position for a trainee in the Criminal Research Department. As of December the 31st, 2022, the State Archives had 7 vacant positions, or 11.48% of their positions. 3 of these vacancies have existed since on or before December 31st, 2021. We can now turn to the key observations starting on page 5. The first observation notes that the steady growth of physical and electronic collections continues. Throughout each fiscal year, the State Archives makes determinations on whether certain local and state records are of permanent value. These items include government and citizen records, artwork, and historical papers. The agency collects and maintains these records and other items on behalf of the state. Since fiscal 2018, the number of items in the physical and electronic collections grew by 3.3% and 5.5% respectively, currently leading to the current items comprising over 400,000 cubic feet of materials, along with more than 167,000 gigabytes of electronic data. A full breakdown on the physical and electronic data in the archives is illustrated, Exhibit 3, pardon me. That's the middle of page 5. Exhibit 4 on page 6 illustrates changes in the number of database records managed by the State Archives. This data is shown since fiscal 2018, reflected as thousands of gigabytes of storage. According to the agency, a new data system was implemented in fiscal 2020, resulting in the removal of several large database servers and 4.6 million records. As the Exhibit 4 shows, the decrease was temporary as database records managed in fiscal 2022 were above 22 million records. The Maryland Manual Online provides a comprehensive guide to government and resources available through the state. The manual includes items related to each branch of government, as well as services and assistance available to the public. The manual also provides information on taxes, state laws, and the Code of Maryland regulations. The State Archives updates the Maryland Manual Online on a daily basis and regularly creates, edits, and uploads new files and graphics to expand the manual. Exhibit 5, found in the middle of page 7, shows that the number of files and graphics created and maintained as part of the Maryland Manual Online has grown by nearly 5,000 items, good for a 27% increase since fiscal 2018. The third key observation, found at the bottom of page 7, notes that the State Archives regularly hosts a number of programs for the general public. These programs include a wide variety of tours, lectures, and other programs. These offerings span a wide array of historical topics and have covered multiple different areas. Exhibit 6, found on page 8, displays the number of public programs that have been offered each year. While the number of programs held by the State Archives was impacted by the COVID-19 pandemic, the ability to host virtual programs did compensate for the loss of in-person programming. However, without data that displays the number of attendees at both types of programs, virtual and in-person, it is difficult to ascertain whether or not virtual events and in-person events have similar numbers of attendees, or if one is more effective than the other. In keeping with today's theme, Mr. Chair, we ask that the State Archives comment on if attendance data is kept for programs offered, and if there is a set of best practices that the agency is following to determine an effective balance of in-person and virtual events that maximizes public accessibility and attendance. Lastly, on page 9, we'll find that the recommendation is to concur with the governor's allowance, and I am happy to take any questions.
Thank you very much, and thank you for taking a long time until I got back, so the vice chair wouldn't have to take on anything.
I had to just sort of guide myself.
Are there any questions for the analysts? All right, seeing none, you gave a thorough analysis. Thank you very much.
Sir.
Now we'll turn to State Archives and Elaine Bachman, the State Archivist. And please bring up anyone that you want and make sure you just introduce those individuals.
Good afternoon. Thank you, Chair Bridges, Vice Chair Chang, members of the subcommittee. I'm Elaine Grice Bachman. I am your State Archivist, and it is my honor to represent all of the staff of the State Archives here today. And I brought with me my leadership team, Emily Olin Squires and Corey Lewis, who both individually have decades of service to the archives and expertise in reference and research, imaging, digitization, electronic archives, and I'm very pleased to have been able to appoint both of them as Assistant State Archivists in October. I also want to acknowledge and thank Teresa Foley, who is here with us today. She is our Director of Administration, and her Deputy John Talon, as well as Liz Coelho, who serves as our Archives Legislative Liaison. Thank you, Mr. Polico, for your analysis. Thank you for coming down the street and visiting us and getting to know our agency and what we do. We appreciate that analysis. We appreciate your recommendation. I will refer you all to my written testimony, and rather than read that to you, I'll just make a couple of remarks. The afternoon is getting late. We're grateful for the governor's allowance. We're really grateful that the increase to our budget, specifically in information technology, is going to allow us to replace our electronic equipment, which is necessary to maintain and receive records, to preserve them, and then to serve them up to the public. That is a constantly needing upgrades to software and hardware. That's going to allow us to do that and ensure that. It is not surprising, I'm sure, to all of you that digital records are increasing. And it's not just that we are receiving more records, what we call born digital, but we are constantly prioritizing our paper records and digitizing them so that they can be more accessible. People come to see us in our agency, but more and more, particularly during the pandemic, we needed to make those available remotely, and that is a ever-demanding increase, and that is what we are trying to meet in digitization. On behalf of all the staff, I want to thank the governor's allowance for the generally funded PIN position to support our federally mandated 3 to 5 day turnaround for FBI NICS requests. In the past, we have had one staff person who handles these. Each of those can take up to 3 to 5 hours of research, and as that backs up, we would have to pull staff out of their other duties in order to serve the Brady Act, to be in compliance with the Brady Act. So that's a huge help to us, so thank you. So, my initial thought in testifying is just to say thank you, but Jacob did ask us to comment on public programs. We're happy to do that. We do offer a wide variety of public programs. Emily did some analysis of attendance on each of those over the past year, and we averaged about 95 people per program. But as you all know, in the pandemic, when you can start to offer virtual programs, one of the great benefits we've discovered is that something like our Lunch and Learn program, which is done in conjunction with the Enoch Pratt Library, where we host a speaker, it's recorded and people are watching that all over the world. So we really can't always track those numbers, but we balance between what is the appropriate topic to offer remotely through an online lecture, and where do we want to have a small individualized program at the archives, face-to-face, training in records and genealogy, et cetera. So it's a balance. We're actually really happy with the ability that we did all learn over the pandemic to do remote program, and we think it's a benefit. And with that, I will also say that in our testimony, I have a link to our annual report that talks about all the things that we do, but I'm happy to answer any questions you have today.
Thank you very much. I do have one question before I turn it over to anybody else. I was looking at the fact that there are, and I know you're getting one additional PIN to help with what you just talked about, but you've had within the agency 3 of 7 vacancies have gone unfilled since December of 2021. Can you tell us a little bit about what's going on with those 3 vacancies?
I can happily tell you that all the vacancies are now in active recruitment, either with interviews or offers, or in the process of being reclassified to serve in the departments in which we either lost people and haven't been able to fulfill that, or realigning our operations. So they're all actively recruited.
So they weren't being recruited before, or they were
Well,
just
they
reclassified?
were to the extent that we could. Like most things slowed down the pandemic.
Yep.
Like all agencies, we sometimes have a hard time getting the candidate. We want to accept the position because of either the length of time it takes to offer that position or competition from the federal agencies that are also recruiting archivists. So,
got it. It's a problem with all of our state agencies right now.
It's a theme.
So, yeah. Any other questions? All right. Thank you very much.
Thank you very much.
Appreciate you being here. And so with that, we will end the hearing for the State Archives and turn to the Maryland Department of Emergency Management. We'll first hear from our budget analyst, Samantha Tapia.
Thank you, Mr. Chair and members of the committee. I'll try to be briefer than usual. Let's see. So the budget for fiscal 2024 increases by for MDEM increases by $529.3 million, or almost 137%, to $916 million in the budget as introduced. But this is overstated while a recent budget amendment is still being processed. Possibly might be signed as we speak, but I haven't got an update on that. That would reduce the overall budget increase by approximately $245 million, or an increase of 36.6%. So you can see that the larger increase on the front page operating budget summary. You can see the budget amendment in Exhibit 1 and a breakdown of that, including the public assistant disaster grants as well as the cybersecurity grants. And then in Exhibit 2 on page 3, what the difference actually looks like if you include the budget amendment. Where it goes, Exhibit 2 and actually Exhibit 3 on page 4, 75% of the budget is going to the FEMA federal pass-through disaster grants. Another 20% is occupied by the 911 surcharge fees. And other large changes are a result of chapters 241 and 243 of 2022, which established the Cyber Preparedness Unit and provided new guidance on cybersecurity and water and sewer infrastructure. That resulted in 6 new regular positions and 4 new contractual FTE positions for the new cyber office and in the Office of Resilience. So a couple notes on the cybersecurity funding. Again, Chapter 241 and 243. 241 establishing the Cyber Preparedness Unit and 243 establishing the Local Cybersecurity Support Fund, which is reflected in a new block of $7.2 million in the budget. Fiscal notes for those bills report that there's also, or has been, $200 million in the dedicated purpose account for cybersecurity. Comments, we requested comments related to this on how MDEM is going to coordinate with DO-IT in the use of the cybersecurity funds that are already allocated, and then whether they plan to draw from the dedicated purpose account any further. Second issue before our main issues. Mesonet, pretty straightforward. The Mesonet project started this past year, or was started being built this past year. It's a network of weather towers to provide new data for severe storm and flood preparedness. But because it's not a capital project or an IT project, there isn't a usual reliable way to track progress for the project. So we've recommended committee narrative to request a report later this year on the status of the project, including budgetary and operational history and future plans. So issues, federal disaster grants, and the 911 board. The federal disaster grant block increases by nearly 58% after accounting for the fiscal 2023 budget amendment. So this means a total of $680 million at a nearly $250 million increase. And we include a summary outline of project eligibility requirements listed page 9 and 10. And also the distribution of awarded disaster aid by jurisdiction as of December 2022, Exhibit 6 on page 11. Given that, we requested MDEM comment on whether the new disaster funding accounts for claims already submitted, just in terms of the total amount that's been decided on for the increase. Whether that is accounted for by applications for funding that have already been submitted, or whether this is calculated in anticipation of future applications, and then if so, how that anticipated amount is decided. And last, we have the 911 board and 911 surcharge fees. The current statute provides that 50 cents, the state shares 50 cents per line for the 911 surcharge, and then per county, it's up to $1.50. Last year's JCR requested that the surcharge revenue and distribution be reported with the Managing for Results data, and that was included. And a sample of that is included in the analysis in Exhibit 7 on page 13. There's been at least one question and pointed out by a couple others that the volatility in the numbers in the funding from year to year. Part of that is due to the difference by county for the county share. Some counties are as low as 50 cents all the way up to the maximum of $1.50 per line. But still, there is still some questions about how much that changes per county and per year. MDEM reported in October that there was difficulty obtaining estimates of the amounts due to phone service carriers considering the number of lines they have open in a jurisdiction to be private information. So we've requested MDEM comment on whether this problem has been resolved and what the timeline is and or will be for receiving new data moving forward. We've also requested commentary on how the county level surcharge rates are decided that vary, the surcharge rate that varies for the county level, and how the funding amounts reported in the MFR this year and in the budget books were determined. And leaving out the last issue for brevity, the JCR reports submitted in the first half of fiscal 2023, are also in the back of the analysis. And other than that, we concur with the governor's budget. And I can take questions or we can move on to the agency.
All right, thank you very much. Are there any questions for the analyst? Seeing none, you gave us a very thorough analysis. Thank you very much. With that, we will turn to the department, and we'll bring up Secretary Russell Strickland. Please bring up anyone you want, and make sure you just identify who those individuals are for us.
I have to my right is our Deputy Chaz Eby. To my left is our Director of Mission Support, Janet Moncrief. And then sitting back there is Anna Sierra, who is our Chief Development Officer and Chief Legislative Officer. And then next to her is Rob Holer, who is our Chief Financial Officer. So with that, first and foremost, Chair Bridges and members of the committee, thank you for having us here today. We appreciate the opportunity to update the subcommittee on the department's activities and address the items contained in the operating budget analysis prepared by the Department of Legislative Services. We very much would like to acknowledge and thank Samantha, who has spent many hours working with us to understand our department and our budget. She's been wonderful to work with this year, and I'd also like to recognize our DBM analyst, who has provided invaluable guidance as we continue to adjust to our status as a new standalone department. And with that, we have provided a written response to all of the questions that are raised, and we would be more than happy to go through and answer any questions you have specifically.
Are there any questions? I could start. I just wanted to at least get a better understanding of the way that you're going to work with DOIT, Department of Information and Technology, with the cybersecurity. Just not sure how that works just yet, so if you can comment a little bit more.
I would say it's a growing relationship, and it's based upon the law that was passed last year, and we are working with them in a very team concept, particularly with the federal cyber grant that has been offered to the state. So we have a planning committee that is co-chaired by both DOIT and Department of Emergency Management. So we collaborate operationally back and forth all the time. We operate a cyber preparedness unit, which works with local jurisdictions to basically address that risk the same as we do any risk, whether it be a tornado, flooding condition, whatever. So we work on assessment, planning, training, and exercise with the local jurisdictions. In that mode, we look to DOIT as the technical expertise. to come in and make sure that what we're offering and providing is technically accurate. So the relationship is there, and we're working through it.
Ever growing.
Yes.
Got it. One last question from me. So some of the members of the committee are new this year, and so one thing that we were talking about that you maybe want to explain a little bit more is the disaster grant distribution and how those work. I know they're grants, and so you know, if you could just explain to the committee how jurisdictions are selected or nonprofits selected for those grant awards.
So the federal grants that we receive are really broken into two categories, maybe three, depending upon how you look at it. But it's really preparedness grants and then disaster grants. Disaster grants you get when you have a disaster. COVID-19 was a disaster. So we have a federally declared national disaster. So that is the disaster monies we utilize. I believe the last natural disaster declaration we had from the federal government was Isaias. So we're still working that disaster. The other side, there are preparedness grants. And the preparedness grants, each one of them have their own set of rules that we obviously have to play by. But basically, on the emergency management planning grant, 50% of that grant that's received goes to the local jurisdictions. The other 50% is held by the state, and it's our operating funds as well as additional assistance to other state agencies. The Homeland Security Grant Program, 80% of that grant goes to the local jurisdictions, 20% is held back by the state. And again, our operating budget, Homeland Security's operating budget with that. And that's in a nutshell, basically, those grants. I can go into any specifics if you're interested, but you know, overall, that's a real high level, simple, straightforward.
I'm sure if any of the members have additional questions, they'll ask those as well.
Absolutely.
Thank you. Mr. Vice Chair.
Thank you, Mr. Chairman, and I appreciate you having our secretary. Pleasure to see you.
Thank you.
I'll explain for some of the new members. I think he was talking to me. I'm one of the new members.
Okay.
And so looking back at the disaster grant distribution on Exhibit 6, you know, there are some huge disparities, quite frankly, between certain jurisdictions. I'd just like to bring up my home county, Prince George's, the second largest jurisdiction in the state. Could you speak to how we got $13 million, whereas other counties, naming specifically Washington, that sticks out?
Right.
A much smaller jurisdiction.
First off, COVID is not closed out.
Right.
That's number one to keep in mind. So the federal government has notified us that as of May 11th, both the health disaster will be halted, as well as it will be the end of the period of performance for the FEMA disaster grant. And it's that FEMA disaster grant that you're seeing here. To date, I think we have handled something like 752 what we would call worksheets for that. It's really up to the local jurisdiction as to when and how they submit to us for their reimbursement. So Prince George's County may not have gotten all of their data in yet and their request in. And we'll go into a closeout period of where we're tracking them and trying to get them to give us the information that is of reimbursable activities that they perform.
I appreciate that you said that specific last statement there. So you would agree that it's important that Prince George's County, which has received 1% in comparison to other jurisdictions, that they step up, get organized, and get their requests in?
That's correct.
Well, Mr. Secretary, I appreciate you being so straightforward with us. I'd like to ask that you reach out to our county executive and our county council.
I will reach out to your local emergency manager, Ronnie Gill, and have a conversation.
Please, and I'd like you to send him this specific exhibit, because it's truly embarrassing, quite frankly.
I understand.
Thank you.
Thank you, Mr. Vice Chair. Any other questions? All right. Seeing none, this is the last hearing for the day, and so we can now close it out. And so, Mr. Secretary, thank you and your staff for being here. That will end the hearing for the Maryland Department of Emergency Management, and that will end our hearings for today. Thank you all.
Thank you.
Thanks.